Doctor, how serious are venous diseases?
It's very serious. They can range from just being a nuisance, such as a varicose vein, to actually acquiring what the most lethal would be a DVT, or a deep venous thrombosis. And the risk of that is eventually it can transition to a pulmonary embolism. Right here to my left, you can see a vein right here, and right here you can see the accumulation of a blood clot.
Okay.
And as the blood clot accumulates, it actually can travel upward towards your lungs, and that can cause a pulmonary embolism. And if that gets lodged in your lungs, that can be fatal and very serious.
Now, what are the risk factors for blood clots?
Now, for blood clots, there's three main risk factors. Obviously, injury would be one. Second would be having some underlying coagulability disease, some genetic predisposition. And the last being stasis, being immobile, not being able to move. Often we see this in patients who take recent travel, and also in hospitals patients who can't move because they're bedridden during their care.
Now, where do they normally occur?
Typically, a blood clot will often start in your legs. And the worst is they will travel up to your lungs.
Wow. Now, how does it affect the rest of the body? If they're forming in the legs, may possibly go up into the lungs, does it affect other areas of your body?
Well, obviously, yes. As they start forming in your legs, your leg can be quite painful. So it can swell, you can have some redness, some erythema, as we say it, and pain. And then the worst is if they go up to the lungs and they get dislodged in the lungs, and that's when you can get some shortness of breath or even have a cardiac arrest.